Okay, we're going to start session 3B3. This session is on stem cell therapy in India. I'd like to thank our sponsors for this section, the StemRx Bioscience Solutions. And the first speaker for this session is actually going to be the founder and director of StemRx Bioscience. It's Mahajan. He's a urologist by training. He was a professor of surgery, and in the last 4 years, he's dedicated his practice to regenerative medicine and stem cell therapies. And he's going to present to us his talk on his clinical experience with the stem cell therapies for the last 4 years. So, Dr. Mahajan, thank you.
Thank you for the nice introduction. Good morning to you all, and welcome to the session on Innovations in Health Sciences. I'm thankful to the organizers for the University Knowledge for Medical Sciences, the both parts, to bringing this platform where last 2 days we have been hearing for a lot of clinicians, surgeons, as well as researchers in different fields of medicine. Each of them were specialists in their subject, doing a lot of new work. I have a special thanks for Dr. Chandan Singh, who took an effort for the last 1 year to bring this platform. Most of us have been hearing the last few days on specialty work done by many of the researchers. Today, I'm going to present you something different, not in research work but an experience. This is an experience of mine worked over for the 4.5 years practicing autologous stem cell therapy. My total practice was restricted to autologous stem cell therapy. When we talk of regenerative medicine, we should think of what kind of basket it is. It's a basket which opens up. You will get a lot of innovations which probably no other science till date has done. Thereafter, we will see a little bit on the health crisis, where we are going, what the present scenario with the proven therapies, where we are planning, what is the stage where we are coming in now, and thereafter my experience I put in, which is going to change the paradigms of health services, health sciences in future. When you open this basket, you will get the new horizon of life. Not only that, many of the fictions which we were having in earlier life, this cannot be done. Autoimmune conditions you can take, many of the malignancies, many of other conditions like dystrophies, which were really fiction for the treatment, they will become fact after when we learn that stem cells can do miracles. These are the microscopic cells present in the body, existing in the niche-like structure where they get differentiated. Not only that part, they decide our fate, they decide our lifeline, what we suffer and what long we live. This science is not one day and not a rocket science. It's worked over a traditional, it has been researched out over a period of more than 100 years. Collins, we all know he is the father of embryology. He was one who first defined and fertilized egg can differentiate into different type of tissues or different type of cells. The story of this started from the benches of such scientists and researchers, and till now it has come to the stage where it is gone to the beds of the patients for the treatment or therapeutic purpose. The entry of this science, regenerative medicine, is right time entering in the therapeutic applications or going to the bed at the time where the entire world is going to health crisis. We all know what does health crisis does mean. My colleagues have already in the last 2 days sessions they have spoken about the health crisis. It is one escalation of the cost day by day going on with treatment. Any cost which escalates, definitely it doesn't reach to the treatment of the poor or needy people. First part. And second part, with advancing research in the proven therapies, what we are achieving is a longevity of life, definitely. But this longevity of life is associated with aging disease. It is not a gracious aging what we are getting it like. Again, it is adding a cost, both ways. The proven therapies and their research has only added a cost without having solution to many of the conditions which still exist, and we always say to the patient, yes, we have to live with this disease and die with the disease. Like autoimmune disease, organ failure, genetic disease, cancer, degenerative, developmental, congenital, all these conditions if you see, do we have any answer to treat them? Can we say I'm going to cure you. I don't think anyone of can say to them, yes, we can cure you. We can just treat their signs and symptoms. Even if you take autoimmune diseases, what the most research has come is monoclonal antibodies. What can be done? You can just postpone the symptoms of the disease and give a temporary relief to the patient for a month or two, an escalating cost which is going to kill the people. Same way, organ failures. We talk of a lot of new surgeries coming in, new techniques of transplant, cardiac transplant, liver transplant. Yes, we do too. Technology is advanced there, but what about the rejections? Do you have any solution? We don't have any solution for the rejections. We don't have any organ shops where we can go buy our organ. The shortage of organ cannot be fulfilled. So these are the questions we need to answer with the puron therapies where we don't have any solution. Similarly, what we do with the genetic disease, we say the same thing. Please, you have to live with the disease, die with the disease. Cancers. We have a lot of people talking about the cancers. Can we cure it completely? We just can postpone the recurrences and metastasis. These are the situations where with all the advances what we have done, still the answers are not found for the solutions. A country like India is spending billions of rupees on the research and health sectors on it, but having no solutions. A country like India cannot afford with the health crisis going on today. We need, no, it's just a global presentation of different conditions where we still don't have solutions, but the cost money spent for each treatment without having a cure is in thousands of dollars. Hence, we need to think of parallel thinking. Can we have some other science to work on this crisis? Very well said by Albert Einstein. We can't solve the problem by using the same kind of thinking we used when we created them. Remember, if you are going to add only research on the same therapies, the answers will never come. We need to have a parallel science which can, or we can innovate the new science which can give new therapies and new solutions to the problems. This is a science where it comes in birth of regenerative medicine. When I understood the limitations of this conventional science, that made me to open this box of basket of regenerative medicine, where the microscopic workers are their miracle workers, the stem cells which are working miraculously to give us a new hope of life. Here you can understand one basic understanding you can get. The power of regeneration or strength of regeneration is a gift, God's gift given to any living being. A fish biting a couch. Power of regeneration to the couch is that within 15 days they regenerate the organs back to normal. Similarly the salamanders. So we understand the power of regeneration is not limited. It is unlimited power. And the same power is given to us also for regeneration issues. Understanding this, when I started my practice with one disease, I could see there is benefits coming in many other conditions. I restricted my total practice to autologous stem cell therapies, that too needle manipulation. What I am going to share you today is my experience, and not research at all. This is an experience collected over a period of 4.5 years, where I treated more than around 2,000 patients of different categories from different diseases. Enrichment is just by name. There are many more conditions. This is a category-wise differentiation of conditions where I could collect the data of my treated patients. Orthopedic conditions, AIDS at 37. Neurological conditions, neurological, 5 something figure is there. If you can see the figure, this comes to around 1990 or some figure comes in that line. The orthopedic conditions most commonly were avian, or vascular necrosis of humerine, osteoarthritis, non-limb fractures, tendinitis, sports injury, the neurological disorders were there, developmental conditions were there, then autoimmune conditions were there like multiple sclerosis, then spondylitis, ankylosing spondylitis, then muscular dystrophies were there. Before I go ahead, I had simple understanding what is the power of healing. If you see a small injury takes place, clot